Welcome to the Foundation Dental Podcast. I am your host, Dr. Jim Arnold, and I'm really excited about today's guest. We were introduced earlier this year by a mutual friend, and he has been quietly redefining what modern dentistry can be. Dr. Tom Larkin has spent decades bridging dentistry and medicine, leading the shift towards prevention, early detection, and whole body health. He's the founder of Proactive Oral Wellness and creator of the Larkin Protocol, a system transforming how dentists and hygienists understand the oral systemic connection. And here's what I love most. He lives right next door to the ruler of Dubai, Sheikh Mohammed, in Lexington, Kentucky. So, that's Tom in a nutshell. He's smart, grounded, and connected to excellence in every form. So, in this episode, we're going to talk about Dentistry 3.0, biofilm science, and how prevention is reshaping both health and leadership in dentistry. So, let's get started. Tom, thanks for being here, man. I really appreciate it.
Thank you. I'm really looking forward to this, Jim.
Yeah, no, absolutely. You spent decades, promoting oral systemic health and, biological dentistry. So what was the moment? What was the moment that you knew that dentistry had to shift from reactive, treatment of disease to proactive health optimization? What made the change for you?
So my change happened at 9 years. Okay. And I think everybody probably hits that point at about 10 years of restorative care where you're just like, is this all there is? There's just more holes to fill and more
Yeah.
disease at the time to refer out. And it was just a moment of reflection. I was just kind of tired of it. And
Hmm.
I read an article about somebody who was extremely controversial at the time that
Huh.
was curing gum disease and helping people with decay. And I'm that guy that I will search out an outlier. I'm naturally kind of that person. I'm not a skeptic.
Like that too, Tom. I'm the
Yeah.
same way. I love it.
And so there's no internet. So this is 89. And I find myself in Washington, D.C. And this is infamous Dr. Paul Kais, who was at NIH for 30 years. He
Huh.
did all of the groundwork in prevention, all of the initial work with dental caries. That was all his stuff.
Hmm.
He invented fluoride trays. And so he did everything. His initial work was on caries. And you'll see tons and tons of groundbreaking work on dental caries, theories of transmission and whatever. And then he switched over to gum disease. And he wasn't controversial until he switched over to gum disease and he started stepping on the periodontist's, toes. And the whole thing was that gum disease can be cured. And at the time, gum disease was, 4 millimeter pockets were surgically corrected with a gingivectomy. So he became kind of red hot. And I went and got trained. And basically the training was we take a sample of the biofilm, put it under a microscope, and you're at risk. And we are using antimicrobials. And at that point, there weren't antimicrobials. So we used diluted bleach. And there wasn't a delivery system for antimicrobials through the handpiece. So we would take the little fertilizer containers that you buy at Lowe's and pump them up. And we would put diluted solution and hook it up to the Cavitron. And it was really, and then Cavitrons only came with the fat tips. And one of the guys in the group custom made the slim tips. I mean,
No way.
this was really groundbreaking stuff, but it was grassroots. Okay. And it worked.
Okay.
It
Well,
worked.
Tom, is this the same thing I read about? I read about something like in 2017 that you were the one who did something with microscopy to make the oral biofilm visible. Were you part of that, or am I?
No, no, no. What I did was I kind of revived Dr. Kaiser's protocol with
Okay.
a new microscope. Okay,
Oh, okay.
I needed an updated microscope
Hmm.
because in order to do training, and I do a lot of virtual training, I need a standardized thing, and I found the guy to do it. And so no, I haven't done any discovery.
Okay.
All credit to Dr. Kais,
Hmm.
uh, and I just basically took his work, and it's evolved over the decades. From I think he started, doing all his work with caries in the 60s, and I met him in 89.
Huh.
And he lived to be 100. His wife lived to be 101. So much for the oral systemic connection. And then his standard antimicrobial was baking soda and hydrogen peroxide. That was his standard home care. And he got tremendous results with patients. And that put me on that path to see, I'm seeing patients on recare that don't have problems it's a different way of practicing that would not attract everyone. Some
Hmm.
people, want to see people that need work, but
Sure.
I was inspired and I saw what happened to the hygienist. The hygienist began to practice with a lot of confidence because before it was always they never knew who was going to get better or who was going to get worse, but now they had confidence. And when patients get confidence, they choose more care. So back in the early 90s, veneers began to be a big thing. And when a person goes to the dentist and they don't have something wrong, but they have confidence, they're much more likely to choose veneers than when they go and get the fact that, hey, you've got two cavities now and you got this and you got that. So
Absolutely.
it was kind of a mushroom effect.
Hmm.
And then what really caused my major pivot was 2012 when I went to one of the first meetings of the American Academy of Oral Systemic Health. That's when I met Dr. Bale. That's
Hmm.
when I learned that this was connected. So I was doing prevention for prevention's sake. I didn't know about the oral systemic stuff until Dr. Bale came along, and then I became a patient. I became an advocate, and then I started to create courses because I knew that dentists, this is a very niche deal.
Hmm.
Dentists don't
Absolutely.
know much about it. And then what happened is the world, it's kind of like I was kind of like the Maytag repairman, but now not anymore because our healthcare system is so broken and everyone's out looking for alternatives. If you look at the functional medicine influencers, people are signing up to get fit, to get healthy. I know you're on an extensive health journey to get healthy,
True.
and people are becoming empowered. Well, dentistry is a part of that whole thing. Okay.
Yeah.
The problem is the dentists don't know it. The physicians are all over this. Okay.
Yeah.
I went to a meeting last December. It's called A4M. It's the functional medicine group, 7,000 physicians in Vegas. And
Wow.
I saw firsthand, there was only a handful of dentists and I knew them, but I was like, wow, we are not clued into this. And to be truthful, those functional medicine doctors cannot fully practice without a dentist. That's what I knew. And that's where I felt
Boy.
Dr. Bale. He
Yes.
needs salivary testing.
Hmm.
He needs a CT scan. He needs a sleep study. Otherwise, he cannot complete your profile when you come in as a new patient.
Hmm. I love that. This is just a long time coming. I mean, obviously,
Yeah,
you've been doing this for decades, but
right.
it's incredible, Tom. I mean, even when I was probably 10 years out of dental school, I graduated in 96. I'd say
Okay.
2005, 2010, there were a lot more people starting to talk about it. And the
Yeah,
crazy thing, Tom, I had physicians as patients who kind of poo-pooed the whole thing. Like
yeah,
they said, "Oh, what's in your mouth has nothing to do with the rest of the body." I said, "No,
right.
actually, there,
Yeah,
there are a lot of studies that show
yeah,
how closely connected everything is." And I was dumbfounded by these physicians who just didn't
right.
really believe in that.
Yeah, yeah. And the most incredible thing, and like I told you, Dr. Bale was here last Thursday,
Huh, huh.
um, and his record is still intact. He's practiced over 20 years. He's never had one patient have a heart attack or stroke.
Hmm.
There's a host of people that he's trained that have the exact same record. We're talking about
Wow.
tens of thousands of patients, and he also has a 100% money back guarantee.
Hmm.
That's just hard to imagine because heart disease is our number one killer, and he
Yeah.
has a methodology that has a 100% track record, and no one knows about it. No one knows.
Unbelievable.
Yeah,
Tom, I tell you what, you've certainly been an evangelist for this for a long time. And I was
yeah,
so sad that I couldn't make it back in
yeah,
April because
yeah.
I was actually in Dubai, as I
Right.
recall. But at any rate, it's really exciting. And, for me, I'm somewhat of a neophyte in this area just because, I sold my practices about 10 years ago and stopped practicing about 5 years ago. But now being kind of more in the education space and bringing rock star educators together,
Right.
niche experts who like
Right.
you who know their stuff inside and out. So I'm so excited to have you kind of on the team and as somebody who's going to contribute a lot to the mastermind that we're building.
Absolutely. No,
Really
it's
exciting.
a privilege. It's a privilege.
So, I wanted to ask you, you talk about Dentistry 3.0 in the Larkin Protocol.
Yeah.
So tell me about the Larkin Protocol and how it changes, kind of treatment regimens and how it changes kind of the traditional dentist business model.
So that kind of what that did is it was an evolution. So my wheelhouse was training with the microscope, and I decided about 5 years ago to have a live event. but I wanted to do a different kind of a live event. I wanted to do one day kind of didactic, and then the second day clinical hands-on, because
Mm.
that's the way I want to purchase technology. And my
Hmm.
first event was April of 2020, got canceled because of COVID.
Oh, talk
And
about bad timing.
bad
Jeez.
timing. So the technologies that I had identified were the microscope, the diode laser in hygiene, and also got at the time guided biofilm therapy, which is a Swiss company. And
Mm.
so the next meeting that we had, that became a part of the meeting. And then just by meeting people and networking, I learned about ozone water. I learned a lot about
Oh,
that during
yeah.
COVID. Now that's not
Right.
ozone. That's not
Hmm.
ozone gas. Ozone gas requires training.
Mm.
This water that's ozonated, that's a very, it's just it's just a holistic antimicrobial. It's not chemical, but it kills everything, right? So I learned about ozone water, and so then that became part of what I called the protocol. The protocol is the early diagnosis and treatment of gum disease, which
Okay.
and so what I did is I've kind of painted a broad brush of not only the diagnosis, but what are some of the cutting edge technologies like lasers and irrigation with ozone water and
Mm.
things like that, and prebiotics, probiotics, just kind of cutting edge things. And so people have kind of every meeting that I've had has been different. Uh,
Mm.
in April, that dentist from Victoria Sampson came from London to talk about a new salivary test. Salivary testing is a kind of an exploding area that's a little
Mm.
bit confusing. And so I've tried to bring clarity to that.
Hmm.
Everything starts with the microscope because it's a 2-minute test. We don't charge, it's free. It's just an awareness test,
Mm.
right? Here's what your microbiome looks like. And it's tried and true. I mean, everything that Dr. Kai's theorized is in reality, it's come to fruition.
That's so cool. And it's so cool that you had such amazing mentors.
Yeah.
I mean,
Oh,
like guys who were pioneers
no,
in this
100%.
space.
100%. And I mean, not just there, but in ortho, Bob Garrity, in TMJ, Barney Jenkelson, who started.
Oh, he wrote one of my textbooks, I'm pretty
Yeah,
sure.
yeah. No, I mean these are like some of the greatest guys to me in history. I
Yeah.
don't think dentistry does a good enough job to have like a Hall of Fame or where we recognize
Hmm.
but that's what I was really happy to see you getting Steve Rasner involved. Steve's what a wealth of just clinical
Oh,
expertise, right?
yeah, absolutely. Clinical and communication
Yeah,
and business.
everything. No, it's everything.
Yeah, yeah,
Everything.
truly.
Everything.
There,
So,
there aren't too many guys or women who are just kind of like all around, kind of have
right,
the whole package as he
right,
does.
right. No, I've admired him from a distance. I've never met him personally.
Okay. Well,
But
what's funny. I met him in Bermuda about a year and a half ago at a conference, and we hit it off right away and decided that we were going to do this thing together. And so I got to spend a week with him in Dubai a couple of months ago. And I liked him already, but like actually hanging out with him and teaching
sure.
with him was, I mean, what a privilege. It was extraordinary for myself, for our other speakers, and of course for our attendees. So yeah.
I'm, I'm certain of that. And then you have Jeff Lusky, who's a very talented, very
Oh,
good dentist.
oh my, yes, absolutely. Two rock stars. You know, one of my favorite things, Tom, while we were there was just like being in the pool with them. Like on a couple of
Right,
afternoons, we had some downtime, just
right.
listening to them banter back and forth about, the different CE that they've done, especially in
Yeah,
the surgical space
yeah,
and the different tips. And it was really cool, to see two clinicians operating at such a high level with such
yeah,
mutual respect,
yeah.
and showing the humility to learn from one another. I mean, you know how it is when you're in a
Yeah.
room with other really smart people, isn't it just like invigorating?
No, it's to me, it's a privilege. I mean, and once again, it comes down to that principle of hanging out with people that are smarter than you,
Yeah.
not being intimidated by that scenario. Not everybody will do that, right?
Oh man.
Some people are uncomfortable with that, and you and I find that invigorating. I want to be
Oh,
around people. I don't pretend to know everything,
absolutely.
but boy, I sure know a lot of smart people.
That you know what? That's exactly right. It's about being in the right room.
Yeah,
Who we spend our time with. What's that thing? The five people we spend the most time with determine kind of
yep,
who we're going to be. And
everything,
so, hey man, I want to be a 10, so I'm hanging out with tens.
100%, 100%.
So,
Yeah.
hey, you got to tell me about your neighbor, Sheikh Mohammed, which
Yeah.
you told me about that the first time we were chatting. When I told you I was going to Dubai, you said, "Oh my gosh, I live next to Sheikh Mohammed." I said, "What?"
Yeah.
And then
Yeah.
a few months later, didn't one of his horses win the Kentucky Derby?
Yeah, it was a week after my conference, and so we had taken the tour. I always give a tour after the conference. People want to stay over Sunday morning, and
Cool.
I can get a private tour, which is nice. And they were just talking about this horse next Saturday, and of course, he has spent billions of dollars trying to win the Derby. He's never won
Yeah.
it before, and so everybody remembered the horse. I did too. His name was Sovereignty, and really is probably the best horse he's ever had.
Oh my
So the horse
gosh.
wins the Derby, and
Yeah.
I had a couple people text me and said, I completely paid for my trip. I bet on the Kentucky Derby and
Oh my
from
gosh.
from the horse tour that you did. So yeah,
So is that a guarantee for next year? You guys will see the horse that's going to
that's
win a few months later. Just throw
that's
throw all your money on that one.
it's very unlikely. Okay, statistically unlikely, but once again, just to be around animals like that is
Yeah.
it's
No,
inspiring.
absolutely. And he's just an incredible guy too. The things
He
that he's
really,
done in
people don't
Dubai.
know that. And I was explaining to Dr. Bale when he was here Thursday. I said,
Yeah.
you can look at this horse farm. He has 6 divisions of this. This horse farm here it's massive. I mean, it's
Yeah.
unbelievable. I said he has 6 of these around the globe. Since I've lived in Lexington, he's only been here twice. He has management teams managing this stuff.
Um,
And then you look and see what he's done in Dubai. I mean,
yeah.
this guy is a builder. I mean, he just builds stuff at the highest level and
Yeah.
takes awesome care of his employees. The people who work on this farm
Yeah.
are cared for like nobody's business. They love him. They work their ass off for him.
That's really cool. Hey, you
Yeah,
know what? That's the sign of a good leader. I mean,
yeah,
obviously, we all want to be good leaders within our sphere of influence and
yeah,
whatnot.
yeah,
And when you look at a guy like that, he's a world leader. He's a
yeah,
guy
yeah,
who has innovated and had a
yeah,
vision that turned the desert into one of the most extraordinary cities on the planet.
yeah. Yeah, he has. Yeah, and once again, I'm going with you one some point in the time.
I was gonna say,
Yeah,
we're going back in the spring and then again in the fall. So yeah,
yeah.
we'll have to look at calendars and see if it
Well,
works out.
and the thing that I want to do is, so I want to talk to my people here and say, hey, neighbor, I'm going to Dubai. Can we get a VIP tour of whatever he's doing over there?
Oh
Right?
man. All right, you're in. You're
Yeah,
in.
yeah, yeah, yeah.
Let's go. So, hey, getting back to the science stuff, which,
Right,
I think sometimes dentists get bored with science. They like to cut teeth and, talk about business and all that sort of thing. But I
right.
think that one of the avenues to educating like dentists and getting more dentists on board with this whole movement that's so damn important is, talking about the business model and talking about how
Yeah,
you can monetize this because we're so driven towards productivity and profit and everything that I think that dentists are hesitant to jump into something they don't know anything about. They're hesitant to jump into something that their perception is I'm not going to make as much money because I'm going to be doing all
right.
this diagnostic stuff. So tell us about that a little bit. Like how can dentists do the right thing? You know, take care of patients in the best way possible while also being thriving financially.
Well, this will never compete with All in X, okay, ever.
Sure, of
It's not
course.
for everyone, and
Yeah.
it really, truthfully, is it's for a person that's very purpose driven. People generally just reach out to me,
Hmm.
and they became a dentist for a particular reason. They had a role model. People get into healthcare for different reasons. You can get into healthcare or dentistry to make a lot of money. You can go the surgical path and make a lot of money. There's nothing wrong. I'm not going to judge that. But
Mm.
people and on my podcast, I'll always ask, tell me who was the person in your life who made an influence at you. Generally, it's in your teens, or maybe sometimes it's in college. Who is it?
Hmm.
Was it a teacher? Was it your neighbor? Was it your dentist? Who was it? And there's always one person that you look up to and you say, I want to be like them. They're kind of
Hmm.
kind and loving, and there's an aura around them, right?
Hmm.
So it's not for everybody, and
Hmm.
I did a podcast last week with someone who I trained he was at the meeting last year, and then he completely transformed his office. And he was the one that told me that. He goes, that this isn't for everybody. I go, no, but it certainly was for him, meaning he came away from the meeting and goes, this is the way that I want to practice, and so it's
And Tom, I look at this and think that the two can coexist.
right,
It's incumbent upon us to do everything we can to help our patients be healthier.
correct.
And the mouth is connected to the rest of the body, and we do need to integrate dentistry with medicine a lot more. So it's incumbent upon us to learn what we can to help our patients be healthier. And guess what? You and I were talking before the show started just about that, and how when you have patients who you help like get really healthy, they're a
Right.
lot more likely to trust you. They're a lot more likely to move forward with whatever treatment it is that they want
100%.
or need. And so if you look at it that way, you turn it around on its head a little bit, like by doing the right thing, we're enhancing our relationship, we're doing a better job, and I think we get better compliance from patients.
100%. I mean, statistically, the most important KPI in your practice is hygiene retention, right?
Hmm.
And
Yeah.
I always cite a study. It was done by one of the guys in Dental Intel did a pretty extensive study about how changing that KPI changes your overall gross income, and,
Yeah.
and changing your KPI from 60 to 90% doubles your gross income. Okay, and
Jeez, that's
you're like, why
incredible.
is that? Well, here's why. Okay,
Hmm.
look at the value of a new patient versus an existing patient. And once again, I've got smart people that run the numbers. The value, the money that an existing patient spends on recare is almost double what a new patient spends. Okay, because they trust you and they have
Yeah,
a relationship.
absolutely.
So the better job that you do. So here's the story. I make it very simple. Mrs. Smith is an insulin dependent diabetic. All of
Hmm.
a sudden, your practice pivots and your hygienist and you begin to have a conversation of, Mrs. Smith, we have now learned that the health of your mouth really is important in your diabetes management. And now we're going to do salivary testing because here's what we know. If we can keep your mouth healthier, you are going to be more stable and you use less insulin. There's a definite connection. It's called bidirectional. Now, Mrs. Smith is going, oh, I really didn't know that. What happens to her hygiene retention? She'll never miss that appointment. Now there's a medical reason for her coming for her recare because
Yeah.
she knows that it's helping with her diabetes. See, these are the conversations that the dentist is missing. Now, you can translate that to heart disease. You can translate that to dementia. If a patient has any history of dementia in their family, you say,
Yeah.
oh, there is a connection, and we're going to screen you. And if I screen
Hmm.
spirochetes, and there's all kinds of association with spirochetes and dementia, um,
Yeah.
you're coming in regularly. Now, what happens is on that beautiful spring day, when someone has an appointment to get their teeth cleaned and they want to go play golf, and they cancel most of the time because they don't value their clean,
Yes.
now they keep it. Now your retention goes, your KPI goes from 60 to 90. Okay. So, and I have a practice here that it's one of the startups that I've done. I've done 6 startups in the Lexington area, and it's
Huh.
a holistic practice. And holistic is it's a different thing. And I stay away from some part of it, but
Hmm.
learn from it. Okay. So this is a practice that's 5 or 6 years old. I think it's been 6 years. Doesn't accept new patients. It's full. And who has the discipline to say enough is enough? I need an associate. I need to expand. But the most amazing thing that she did, and then she has shared with me, is that patients apply to be on the waiting list. And I have
No kidding.
hundreds of these applications, Jim. And let me explain
Wow.
something to you. The dentists do not understand much, how savvy patients are.
Yeah.
And when they say, I need someone that knows that the mouth, these are and I have those in the presentation. I just, she shares them with me and I just run them off. The patients are so much more savvy than dentists in general know today. That
That's
there is a connection and they're seeking it. Now, here's the problem. The word holistic is radioactive, and I've known that because I've been around a long time. And
yeah.
I when I did her startup, I said, Rachel, are you? I'm going to forewarn you. Are you okay with this? I said it's going to be fine with your marketing to clients. Patients will seek you out. But I said, are you ready to be ridiculed by your colleagues? She said, yeah, I'm
Yeah.
good with that. I said, well, as long as you don't care, and she's really overcome it, and she has been invited to speak at the university. She's done a good job with it. but it's still a radioactive term to dentists. So
Yeah.
I've been very careful when is staying in the lane of cardiovascular prevention, which is essentially gum disease. Okay.
Yeah.
And this really became a topic about a month ago. And what I did was I went to ChatGPT and I put down all of the components of holistic practice, safe amalgam removal, blah, 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 blah. And I said, tell me the impact on your overall health. Okay. So the first thing I was interested in was fluoride because I hate that conversation, because it's
Yeah.
really polarizing.
Yeah.
Fluoride
Oh my gosh.
has a 5% impact on overall health. Okay. According to AI. And I go,
Okay.
why are we even talking about it? Gum disease had a 70%. Okay. Let's stick to the things that matter the most. Okay. I
Absolutely.
don't want to fight about fluoride. I don't want to fight about root canals. Okay.
Yeah,
A well done root canal is fine in my book. Okay.
I agree.
And are people sensitive to mercury amalgam? And should I don't think you should ever recommend them to be removed.
Hmm.
But if they are removed, if they're safely removed, there's a protocol where the patient and the dentist wear protective gear.
Hmm.
I'm totally cool with that, right?
Yeah.
And
Yeah.
that's essentially what holistic practice is. But I'm really careful with that word because it turns dentists off. Okay. And it turned them off decades ago when I was trying to help Dr. Kai's and his work never really caught on because it got caught in a very confusing morass. And
Yeah.
so
Well, it's what's interesting, Tom, is I think that a lot of times when somebody is speaking at this level, and everything is so clear, and you're talking to dentists who are, trying to learn how to, you know, get patients to say yes to cutting a crown prep, things like that. You're just on such different levels that it
right,
just kind of goes in one ear and out the other.
right.
And, we come out of dental school without communication skills,
Yeah,
without leadership skills, without business skills, and a lot of debt. And so many doctors are just so overwhelmed with all of that stuff,
yeah,
that like learning a new thing is just almost beyond like what they feel like they can do. But
100%.
what I'm thinking about in this conversation, beyond it's just the obvious fact that you'll be a better dentist, and I think you'll be more financially successful doing things the right way. But
Correct.
with the populace, more and more people out there being more and more informed, that's what's going to drive
Yep.
demand.
Yeah.
When guys like you are out there, beating the drums for this, and patients start asking for it,
Yeah.
it's going to take a while, but that shift is going to happen.
Right. And that's kind of the definition of dentistry 3.0. I saw uh, uh, Koyson Coachman
Mm,
about 6 months ago. He did a
okay.
podcast. And it's a little bit of a shift for them because they were very restorative and stuff. And he was saying that very much was the future. So that's kind of validation. I mean,
Yeah.
Koyson had some pretty good prevention stuff there,
Hmm.
but
Hmm.
they can see the future. They can see what's evolving, and
Yeah.
it will be patient driven. It's not going to be, I mean, I don't need to educate patients. My thing is
Yeah.
we don't need to do public service announcements for patients. We
Right.
need to educate dentists on what's available and
Yeah.
how they can pivot, how they can make pivots. So what I do in a consult, I had a really great consult this morning with the hygienist on they asked great questions. And
Hmm.
they said, I always say, tell me exactly what you want, and we'll do this kind of sequentially. We'll start. Well, go as far as you want. Do you want better case acceptance for perio? Great. Nothing better than the microscope. Hands
Yeah.
down. And if that's all you want, that's great. Now, if you want to go a little further and you want to start doing guided biofilm therapy and laser and whatever, and do you want a relationship with a physician, a referring relationship? I can show you exactly how to do that,
Yeah.
what needs to be exchanged back and forth, what tests you need to supply the physician, and vice versa. So it's all there. It'll happen, and it's the momentum is kind of building. I see it.
Yeah. Well, that's cool. One question I've been dying to ask too is the first time a patient sees their oral microbiome
They
moving under the microscope,
they
how do
they,
they react?
they freak out. They generally freak out, and sometimes not in a real good way. I mean,
Yeah.
generally speaking, it's like, oh my gosh, what are those worms doing in my mouth?
Yeah. Oh
Uh,
God.
and they'll say, and this is unbelievable, Jim. They'll say, what are we going to do about it? And when are you going to get started? Okay.
Yeah.
When have you ever had a patient in your life ask you for treatment? Okay.
You know what? You know what that is? That's called reverse poll marketing. I
Yes.
remember we used to have we used to have big charts on the wall with well, we show them a picture of their, their arch that
Yeah.
shows all these big amalgams and all the cracks and all the stuff.
Correct.
And we didn't even have to say anything, just put it on
Yeah.
the screen. They're like, "What the hell is that? And
Yeah.
what are we going to do about it?" Same thing.
Correct.
Yeah.
Exact same thing. So I think people, dentists, especially younger dentists, don't understand this, what you just said and what I just said. They don't
Mm,
understand that communication skills with the patient will literally ask for treatment. The problem is
absolutely.
their skills are so low and they're kind of going in one, they're just spewing out stuff to the patient and not reading, they just don't have that ability to know.
Well,
Yeah.
it's there's so many doctors out there who, have great hands, great clinical skills. They go to
Yeah.
all the courses, but they
Right.
go back to their office and they don't have that thing,
Right.
that communication unlock
Right.
that makes them relatable and
Yeah.
makes patients just say, "Oh my gosh, yes, I would never go anywhere else." And it
Correct.
kind of breaks my heart when I see this, guys who
Yeah.
are spending, tens of thousands of dollars on their education every year, and then
Yeah.
they go back and they're not able to do this exquisite dentistry that they're trained
Right.
to do. Well, this is very similar, I think.
Oh,
It takes a higher level of communication skills to, educate somebody about that.
yeah.
Although, if we use those visual cues, if you
Yeah.
have that on that microscopic movement of the mouth worms, people are
Right.
going to freak out and beg for the treatment.
Yeah. Yeah. It's for the first time ever that they realize that the film on their teeth is
Mm,
alive. Okay.
yeah,
We just scrape it off their teeth and put it under the microscope and it's alive. It's whirring,
yeah.
and just that right there is a big moment for the patient because
Mm,
they don't even when they come in for a cleaning, they just know that it feels good when they're done. The teeth feel smooth. No,
yeah,
no,
yeah.
no, no, no. We paint the picture of this ongoing battle between friendly bacteria and pathogens, and this just goes back and forth. And
So I'm not gonna lie, Tom. Like just this conversation alone is making me want to go brush my teeth again right now. Like I feel like I need to floss, scrape my tongue, brush, rinse. I mean, like really. So that's cool. Now with dentists, I mean, obviously you teach that biological assessment has to come before any restorative care, and
yeah,
biological assessment at a much higher level than what we've been trained to do in the past.
right.
Are you seeing a shift like in terms of dentists' attitudes towards that? I mean, are you getting more and more dentists coming through your programs who just like get it and understand the repercussions if they don't do it in that order?
The big difference that I see, Jim, and I'm being just brutally honest,
Yeah,
is that there are just such financial constraints today. So
yeah,
when someone comes in and needs an implant, and let's say you just did a quick sample, not even a salivary test, because I really do think salivary testing will become the standard of care for implants, and that's a whole nother podcast,
yeah.
another conversation. And let's say that the patient has just extreme dysbiosis but they're sitting there ready to spend a lot of money with you right today. They come in ready to go.
Yeah.
That's a pretty tough deal for a lot. I mean, it's a challenge. Um, on
Yeah.
on one extreme, and it's generally the periodontist who do this to the limit, meaning a periodontist will take 6 months or a year to
Mm,
have your oral environment correct before they'll place an implant. I mean, I know periodontists that have that levels of protocol, and I'm talking about
yeah.
biologically, and they're
Yeah.
doing salivary tests. They're looking at, the DNA, and they're really scrutinizing. The microscope is one level. When you take a salivary test, that's another level because you're looking
Mhm.
at the exact what are the exact levels, and there are people that practice at that level. I don't see that as being practical for a general practitioner when somebody comes in and they got 10 grand in their pocket ready to spend.
Yeah.
It's unfortunate. There are a lot
Yeah.
of pressures today, and the pressures in the marketplace today are real, are real.
Hmm.
What's happened since COVID. is real. I mean, overhead, fixed or variable overhead, both have gone up 20-25%. Reimbursement has been flat. That's putting pressure on practices in a pretty significant way. Right?
Yeah, yeah, absolutely. And you hear it all the time. And then, with the cost of staffing going through the roof
Yeah,
since the pandemic, it
yeah.
makes it really, really difficult from a business standpoint.
But the skills to get out of network, okay.
Yes.
The problem is the skills to get out of network
Hmm.
these are the skills to do it. You can't just wake up one day and say, I'm going out of network and do what you've always been doing, because people aren't going to see the value. They have to see the value. They have to see
Yeah,
that their level of care is higher than what they probably could get anywhere. And then,
yeah,
well, this makes sense, right?
yeah,
So
yeah, absolutely.
you're going to have to pivot. So this comes hand in glove. I mean, I'm not one of those people that I see people kind of beating the drum about a network. They're people that just don't have the personality skills.
Yeah,
You have
yeah,
to have the mojo too, right?
yeah,
I mean,
no doubt about it.
let's be
Yeah.
honest about this. And one of the things that I'm insisting on, that I've been kind of critical on, and this is the 5 years that have led up to from 5 years before COVID, with the advent of podcasts, with the advent of Facebook groups,
Yeah,
there has been kind of a blanket encouragement of entrepreneurship. And at first I thought it was cool. I'm doing this stuff, right? And
yeah,
then I started to back away from it, because this is not for everybody, entrepreneurship. So I think a lot of the distress that you see today, you see a lot of talk about burnout and stress and blah, 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 blah.
yeah.
Some of it is because people became, I call them entrepreneurs. They had zero interest rates, okay, and
Hmm.
15 to 20, and
Yeah,
pressured to own a practice because everyone was owning a practice. And I'm going to tell you something, and you know this, it's a combination of skills to be a practice owner. Okay. And
dude.
if you're deficient in that, dentistry is a very unique, it's a
Oh,
very unique.
it's such a complex
Yeah,
ecosystem that
yeah,
has so many
it is.
systems within it and so many
Yeah,
skill sets that you really have to master in
yeah,
order to kind of do things at a high level on a consistent
yeah.
basis. And by the way, you can't do it all your own.
No,
You have to have a culture that attracts the right team members, and then you've
right,
got to be the kind of leader that not only gets those people in, but nurtures them, puts them in positions to succeed, gives them all the tools to succeed. Because
yeah,
no matter how good you and I are, we can't do it alone.
correct,
Yeah.
correct. So not everybody has that. Not
Yeah.
everybody has it. So when I was teaching at the university, and I was teaching practice management, and my assessment would be, so this is 2012, 13, maybe five,
Yeah.
maybe 5% of new graduates had it, that they could
Hmm.
go look at either buying a practice from a retiring dentist or doing a startup. Okay.
Yeah.
Well, that metric completely changed with social media, and it was like, I'm critical of the people that are selling practices. They're completely indiscriminate. They'll sell practices to anybody, or they'll do startups for anybody. And I
Mm.
only did startups for people that I knew personally, and they had to,
Right.
they had it, right? But I think we have, so some of these people now that are very vocal, I hate dentistry, and I see threads and stuff. Well, there were people that probably they shouldn't have become practice owners to begin
Yeah.
with, right? And so
Oh,
they're kind of,
absolutely.
and then what concerns me the most is, because you and I know what a beautiful profession this is, but when you go on social media and you start telling what a shitty job this is and how horrible it is, you're kind of polluting the water for that undergraduate who might be thinking about this. And
Yeah.
what's the word influence? That's this, we live in an age of influence. We're constantly bombarded by it. And that distresses me, okay?
Hmm.
Because and that's why I am happy about what you're doing, because you're creating role models in a whole complete spectrum
Mm.
of really solid people. And I think these are the people that need to be looked at. And let's just kind of back off the people that know how to market on Facebook, but really they've never done anything. And there's a few of them out there, and
Sure.
I'm not going to name names.
Well, what's interesting. I mean, we could go down about 100 rabbit holes on this whole subject, of course, and we could talk about it for hours. But one of the interesting things, like literally just this morning, I decided the mastermind that I'm putting together that's pretty well built out with six main pillars. Um, I've decided to gear it towards a niche that I don't think is really being covered in terms of masterminds. Going to take it in the direction of fee for service dentistry. And it doesn't mean that people come on board have to go all in or anything like that, but at least moving things a little bit more in that direction so that,
Correct.
insurance companies aren't, making decisions for patients. B, it lowers overhead by 40% immediately, because you're not giving them that huge commission on everything you do.
Yeah.
And C, I think that patients are just going to get better care as a general rule. And it doesn't mean that, people have to blow up their whole PPO practice and that sort of thing. But I just know from experience, I was fee for service my whole career. I was very blessed. I had an amazing team and
Yeah.
everybody communicated well. I mean, we worked hard at it. It's not like it all just came naturally. I mean, we spent hundreds of thousands of dollars to learn
Right.
how to communicate and to
Yeah.
do the work and all that. So for me, I realized that that's a niche that I know. I know it inside and
Yeah.
out. And
Yeah.
several on my team, on the faculty with us, are also in that space. And everything that you're talking about right now, it's like getting outside of network. These
Yeah.
are the things that require that level of leadership and
Yeah.
communication that most docs don't come out of school with. And
Right.
so the more we can help them, kind of learn those things and kind of build those skill sets out, I think the more likely they are to do more of it, and
100%.
everybody wins.
Oh, it's so important because here's what's happened. Because of the flat reimbursements with the PPOs and people trying to make up for this loss, I call it a speeding up model. You're trying to go faster. You're trying to maybe see one or two more patients, or you
Yeah.
cut your hygiene from an hour to 45 minutes. Anything that makes dentistry goes faster will lead to burnout. There is no question about it. We have physical limitations. Dentistry is physically challenging. You're
People
not,
don't know. They don't
no,
get that. They're like,
no,
what? You're just like holding a
no.
drill. Like,
But what you're talking about, because I'm constantly talking about slow down. We're going slower. We're
yeah,
going slower because
yeah,
slower is sustainable.
yeah,
Number of people quitting. I mean, you shouldn't be quitting after 10 years. I mean, that's sad when someone leaves. It's
yeah,
sad
it
when someone
is.
gives it up and quits because
Yeah.
if someone quits, I think they've had improper coaching. I think they
Hmm.
really have had, and they haven't met
Well,
the right people.
yeah, and sometimes dentists just they don't seek out those mentors, so they're not in the right place at the right time, or they don't
Yeah,
even understand like what the possibilities are out there. And
yeah,
that's it's heartbreaking because as you said, it's a phenomenal
yeah,
it's a phenomenal profession. It's a
yeah.
great thing that allows us to do so many good things for patients. And it, I think you've heard the statistics. My first day of dental school, 33 years ago, they said dentists have the highest drug abuse, divorce, and suicide rate of any profession.
Right,
And Tom, I about fell off my chair. That was the first day of dental school. I'm like, what the hell are
right,
you talking about? My dentist
right.
has an amazing life. He's got a nice house and he's got a nice car and,
Yeah,
good family. And I mean, he only comes in and sees me for 3 minutes and then he's probably back in his, office with his feet up on the desk. Like, what are you talking about? And man, then you get out there and you realize just how
yeah,
physically demanding it is, how emotionally demanding it is, how many conversations that we have every day. And
yeah.
so I agree 1,000,000%. Now, I have no problem with efficiencies.
Right,
Efficiencies don't mean going faster. You know what my
right,
motto is? It's slow is smooth and smooth is fast. And so it's about being deliberate. About being intentional. As soon as you touch that tooth with a burr, you know exactly what you're going to do. And you might do in 2 minutes what other people are doing in a half an hour. And
yeah,
guess what? Yes, it's more efficient. Guess what? It's also a lot better, but it has nothing to do with going faster.
right. Yeah. So I think that's some of what I'm seeing, and I'm sure you're kind of seeing it. That just kind of a restlessness and people, unhappiness with whatever, and,
Yeah.
and anything that makes us go faster is going to lead to unhappiness. No
Yeah.
question.
No doubt about it. There's only so many hours in the day, and
Yeah,
if you're trying to see too many patients, it just means that you're going to have to compromise somewhere. If you don't have as much time to communicate, that relationship building isn't there, and so seeing fewer patients is
yeah.
really the way to be more successful. And
It is.
it's
I'm so
simple math.
happy. I'm
Yeah,
so happy that you're working on that. I think it's going to be a phenomenal service, and so they're going to be young people out there that are hopefully hear what you're saying, and
yeah,
and you get their attention. And it's not a Facebook group, and it's not somebody that's done something one time. I see
right.
that they did a startup one time, and now they want to be a consultant for a startup. I was like, really? You
Yeah.
finished yours, and you're going to help everybody else with theirs. And then,
Everybody's an expert, Tom. Didn't you know? Everybody.
no, it's like I said, I I was enamored with information being free and this and the other, but then I became disenchanted with the quality of the information and
Yeah, yeah.
things that I saw people do, and yeah,
Yeah,
so I
we've got to be discerning about where we get our information. And, when
yeah,
you do find mentors, you've got to feel really good about their credibility. And,
yeah.
it's like do your homework, make sure you're jumping into the right room because, if you're in the wrong room, you could go
Well,
another 20 years doing things the wrong way without
so
realizing.
I think people have to have street cred. So I'll tell you a story. I don't share it a lot, but I want to share it with you. I did a I built and sold a dental practice while I was in dental school. Okay, I've never made any
Really?
of that.
Wow.
It's a crazy thing. I started my junior year. When I
I
say
close my
build,
blinds. This is blinding me.
um,
Yeah.
so when I say build, I'm talking about framing and drywall. I'm talking about physically built on the weekends. It was in a small town in the suburbs. I had no money. I cold called a mayor, gave me a line of credit. Okay, I mean, so that's entrepreneur. I was wired differently in dental school, but I'm sitting here as a junior saying, well, I want to practice the day that I graduate, and I need to get started now. And I just went and did this, and it was crazy.
Amazing. Oh
Okay.
my gosh.
So I understand that that's different. That's a DNA thing. I was curious. Life was to me was kind of like a playground. Yeah, why not? Yeah, I'm gonna go fix this space up. It's like, but it's insane in hindsight. I mean, I look at the fearful
Wow.
person I am today. As you get older, experience makes you more fearful.
Yeah, you're more risk averse,
But
right?
but there's nothing like being 25. So when I
Yeah.
see the 25-year-olds today, oh, I've got student loans, I've got this, I go, who gives a shit? You
Yeah.
got your whole life ahead of you. I
Yeah.
never considered any downside. What if I didn't pass my boards? I wasn't at the top of my class. I have a literal freaking construction loan, and I have this remodeling. What if that wasn't in my head? And so
Yeah.
and so when I see these younger people, just victims of, social media influence, whatever,
Yeah.
you just need to go back to the purity of being 25 and having your whole life ahead of you. Let's just go, let's go throw it down.
Yeah, gosh, I love that. And I'm the same way. I think I was very, very much a risk taker when I was younger. And, you get to a point where you see some things go really well, some things maybe not so well, and you get more risk averse. But man, there
Yeah,
is no better profession than
yeah,
dentistry. I mean, there's so few businesses that have the opportunity to not only do great things for patients, but there are 50 different ways to run a practice. And
yeah,
guess what? You don't have to do everything. You can do
no,
exactly the procedures you want on
yeah,
exactly the patients that you want. That's a
yeah,
beautiful thing. And
it
by the
is.
way, from a business standpoint, there are very few businesses out there that are as profitable by percentage,
Right,
when you do it right. But,
right.
it doesn't happen automatically. And unfortunately, I do think that there are people who just assume that once they step into an office as an owner, they're just going to like make gobs and gobs of money. And
Right.
it's just not realistic unless you figure out what you're doing.
Right. Right. Yeah. Well, I'm excited about what you're doing because
Well, I appreciate it.
it's time. It's time to get some
And
really legit experts together.
well,
And
and the
yeah,
cool thing too, Tom, it's like small groups. we're not like 1,000 people or
Right,
300 people. When you got
right.
like 10 or 15 people in a room, like you can really go deep and you
Yeah,
can ask real questions and have real conversations.
yeah,
And not that there's anything wrong with, going to a hotel ballroom to do a course. I mean, I've done a
right,
million of them, as have you, I'm
right,
sure. But you don't get that same one-on-one kind of interaction. You
right.
don't build deep relationships. You can't
Yeah,
necessarily ask those questions that are specific to your situation or your
yeah,
practice. And that's what I saw both in Puerto Vallarta this year and in Dubai,
yeah,
where, they had like 3 to 5 days of complete access where we're eating every meal together. We're
yeah.
having conversational education. We're doing cool activities in the afternoon where the
Right.
conversations continue. And
Yeah,
Tom, after 2 or 3 days, like I wasn't even thinking about who's a student, who's faculty, who's a
right.
videographer, who's a spouse. We're just like all this tight knit group that by
Yeah,
the end of the fifth day, I said, my God, you guys are like family for the rest of my
right,
life. This isn't something where we say goodbye and, wish you
right.
well. It's like, no, guess what? I'm going to be following up with each of you. I want to make sure that you're actually doing the stuff that you learned this week, because if you didn't, I'm going to feel like we didn't do our job.
Yeah, yeah.
And you
No,
can't do that with 100 people. You can do it with,
no,
10.
right, right. No, I love it. I love what you're doing.
Well,
Congratulations.
I love what you're doing too. And it sounds like your dates for your event coming up. Do you have the dates specifically for this upcoming event in April?
Yeah, it's 24th and 25th.
Okay. Well, tell listeners like what this event is and why they should be there, because it sounds extraordinary and I'm heartbroken that I'm going to be out of the country that week.
So it's called the Future of Dental Hygiene. That's kind of how and so this is the sixth version that I've done, and each one has evolved, and each one has, new faculty, just different things. And so going over salivary diagnostics, kind of going into AOX maintenance. I see that as a real necessity. I see dentists just ducking that. We have this all on X.
Oh
I don't want to
man.
do I take it out? Do I unscrew it? Do I put it back? I don't,
Oh man.
out of sight,
Yes.
out of mind. And I
Oh,
said, I'm the person that's always going to take on those challenges. And I said, it's time that we start to talk about what is a maintenance protocol. So I'll have a maintenance protocol of some kind, and it'll be
yeah.
a consensus of a lot of people that I know,
Oh, this is
and
great.
yeah,
Oh my
and
God.
so,
And you're going to be the first one to do this, Tom. You're
yeah,
going to be the
first one,
first one.
yeah.
And there is such a massive need. And
Oh,
you and I both know that there's such a gold rush on the All-in-X market right now. Now,
there is.
I was thinking a few years ago that it was just a fad, but in reality, there are over
No,
30 million edentulous Americans. And
yeah,
so I do think that the need is always going to be there. And I do think it's a phenomenal service. But unfortunately, I do think there are people just jumping in, doing sloppy work to
yeah,
make a buck. And
right.
that is going to lead to all kinds of problems. They're going to have to get untangled.
I'm seeing them already. I mean,
Oh, I bet.
I see it all over the place. So
Yeah.
so I want to address that. Yeah, so that's probably a little bit of a pivot. And once again, everything is new. One of the salivary tests that I'm going to be introducing is MMP8, and Pacific Dental is now doing that on all new patients.
Oh,
And
it,
that's not a bacterial test; it's an inflammation test. And I met the people in Germany who are,
amazing.
I think they're coming to kind of explain it. And once again, I'm a facilitator. Okay,
Mhm.
I need to. I've been fortunate. I haven't really had to seek out these people. They kind of find me, and then I said,
That's
"Hey,
cool.
would you come to my meeting?" And I just kind of put everything together. And so it is. It's the future of hygiene, right? And so if you want to see what these are, and then the second day we break into small groups, and you get to do a sample on somebody and see how easy it is. Then you jump over and use a laser, and then you jump over and do guided biofilm therapy with your hands on, because
Hmm.
that's the way
Awesome.
for me to buy something. I want to put it in my hand. I don't, and
Absolutely.
that's why I designed the course that way. So
So tell me about that. You mentioned hygienists. Like, are hygienists going through some of this training with you, or is
yeah,
it
yeah,
just
yeah.
doctors?
So
Because
it's kind of
hygienists are like they are the heart and soul of our periodontal programs,
right.
and I would guess that the right hygienists get really excited about
Yeah.
this.
Oh, for sure.
Higher level diagnostics, higher level care, higher level relationships, and a sense that they're making a real difference.
Well, it solves all of the problems that that we quote unquote have in the value. So let's say that the hygienist feels undervalued. Well, they're not undervalued, they're undertrained. Because
Yes.
if they come back with these skills and they're introducing salivary diagnostics and there's income to be generated with that, and and let's say that you compensate them 1/3 of what they produce, whatever,
Mm.
it's all there for them. Okay.
Yes.
And that's been my experience from the very first day when I started to compensate my hygienist at extremely high level. And I was fine.
Yep.
I don't care. Everything's good, But the
Yeah.
problem is that when the hygienists demand that kind of compensation when they're doing profies, well, you can't. I'm not, if I just got reimbursed $60 from Delta, and you're making $60 an hour. This is not a business. Okay.
Oh man, you're
And that,
speaking my language.
that doesn't, that will not work. I am not in business to go broke. Okay. So
That's
either
right.
so either you get training or you come up with a model or the dentist, whatever. So my experience has been the dentist will bring the hygiene team, the dentist, because the dentist is really, they're the ones that pay the bills at the end of the day, and they're going to buy
Yeah.
the technology. And if there's one thing that my meeting has been famous for, my vendors will tell you, everybody that comes buys everything. They buy everything
Well,
because
that
they're
means
convicted. They see,
you laid out the information
yeah,
so clearly and the
yes,
benefits to patients, the benefits to the practice, so there's no
yeah,
downside. They're like, they
right,
don't want to reinvent the wheel. Like,
right,
okay, if Tom says this is what to do,
right,
I'm in.
yeah,
And Tom, that's just what a compliment to you. I mean, honestly,
yeah,
like you got to
yeah,
have real credibility for people to do that because I mean, most of the meetings I go to and there's, like very expensive technology, very low number of people actually jump in, which
right.
is a problem for for the
Oh,
vendors who spend,
100%,
tens of thousands of dollars to be there. And if they sell two
100%.
units, it's like, oh my God, why did I do this? But they go to one of your events and
Yeah,
you got not only the right audience, but they're
yeah,
hearing the right message and then
right,
they're getting the right solutions. And
yeah,
that is an amazing combination.
yeah, yeah. And I'll be honest with you, I backed into that. That was not a plan from the beginning. It's like
You
I told
know,
you, everything has evolved and
yes.
evolved into this perfect entity. But it
It's
happened.
so cool. You know
Yeah,
what? And I think that's a lot of what happens to us in life and in the profession. I mean, you can't like have a clear vision of exactly
no,
how things are going to work out. But I'm
right,
convinced that if you do the right things for the right reasons with the
right,
right people, like good things happen.
yeah,
And that's how luxury dental retreats came about. It's like, man, over the last 25 years, I've had all these incredible experiences with these icons in the industry, and we've become friends. We have great relationships. And through those relationships, through the way that I like to practice and the kinds of things I want to do, it's just sort of a perfect storm. But I mean, a year ago, a little over a year ago, it never even occurred to me. But
yeah,
it's just kind of cool to see your thing coming together, see
yeah.
my thing coming together, and to be able to combine. I'm super excited about doing a program together sometime in
Oh,
2026.
100%,
Yeah.
100%.
Very cool. So, last question that I have, I'm thinking about just the oral systemic connection and how obvious it is, and there's just no question. I mean, this is scientifically proven. Are you still seeing a lot of dentists and or physicians who like don't believe it? And, for those people, like how do we communicate? Like what is the biggest piece of evidence or the thing that they should consider to change their minds? Because I
Well,
still hear it.
that's a great question because um, I just the ones that are not seeing what's in front of them, I
Yeah.
I think they're just choosing not to see it. Now, whether or
Yeah.
not they're going to have a personal experience, because a lot of times, a person gets religion when they've had a personal health experience.
Yeah.
And all of
Yeah.
a sudden it's like, oh my gosh, because at the end of the day, your health is everything, right?
Yeah.
It's over everything. So maybe that's going to, or a family member or something like that. But I don't think there's any amount of convincing, because I do know when I first started this, 10 or more years ago, I would get questions about, can you send me some research? Can you get some, now that's not a question anymore. Like you just
Mhm.
said, this is
Yeah.
astounding. So
Yeah.
it's up to you. I think the decision is this. Are you happy with reactive care? And reactive care is a little bit redundant, and a person comes
Hmm.
in and you're doing the same thing over and over again, and it's a little
Yeah.
monotonous. Or do you want to kind of be a little bit more proactive and more giving and more helpful towards your potential.
Yeah.
And that's a personal decision, and I can't, you know.
Yeah, it's interesting. It reminds me of when I was a new dentist, came out of school and had all this like knowledge, just enough to be dangerous, I think for a lot of people coming out of school. But I came out like I knew that 16 surface amalgams really needed to be crowns. Well,
Right.
I was with a lovely older gentleman dentist who was very, very conservative. And so we spent every day on emergencies. It's like just dropping into our schedule over and over. And it was crazy.
Yeah.
And man, what a difference it made when I turned things around and became more proactive. The day goes more smoothly. It's more predictable. Patients are more happy. You're not
Yeah.
dealing with horrible situations. And
Right.
boy, just thinking about it, you can extend that into this whole space.
Yeah.
Instead of being reactive to all this disease,
Right.
why not be proactive and have healthy patients coming in who
Yeah,
then are prepared to do whatever, restorative treatment they either need or want?
for sure. Yeah. Boy, that's it in a nutshell.
Yeah.
Yeah, you got it. You got the message.
What did I miss? Like what did we not talk about that what is there any takeaway that you would like the dentist who listened today to like walk away with? Anything, any pearls of wisdom?
No, I think the last thing you said was the most profound, that whole thing of reactive versus proactive. It's a mindset.
Yeah.
It's a it's a significant, it's the same thing that's happening in medicine. Why are physicians quitting and whatever and becoming or flipping over to functional medicine and getting retrained and they're almost like being born again,
Yeah.
they literally this concept of helping people be the best version of themselves, helping people have the best version of their mouth is an awesome thing, you know.
Yeah.
Yeah,
Well, at the end of the day, Tom, I think one of the things it's really important to remember, and I used to remind my team of this all the time, and I had the best dental team on the planet. I trademarked that best dental team on the planet. They were amazing. And I reminded them on a regular basis that, look, whatever we would want in our own mouths,
yes,
that is what we need to talk to patients about, because if we don't, no one will. I mean,
right,
my God, there's so much need out there. All we have to do is take care of the needs of the patients who come to see us, and there will never be an end to the amount of stuff that we can do to help people get healthier. And
right,
so, it's the golden rule, do unto others as you would have them do unto you. I mean, and I never
100%.
thought about that in terms of dentistry, but it's so true, right?
Yeah, so the standard that I learned in school, there was an oral surgeon that I loved, and I liked oral surgery, and he always said, treat your patients like you would treat your mother, and you
Yeah.
and when you carry that as a decision making process, and you see somebody, and they're in a whatever, and you say, well, what if that was mom? Okay,
Yeah,
if
right.
that needs to be our standard of care, because
Yes.
and not to get off into a rabbit hole, but I've seen some pretty aggressive. There's some teeth that I know are absolutely restorable, but people can rationalize All-on-X. They
Hmm.
rationalize it, but
Yeah,
they'll take out perfectly good, perfectly restorable teeth, right?
I know.
And
I'm
I
seeing
say
more and
to
more of
them,
that.
if that was your mother in the chair, would you take all of her teeth out? I would have a hard time for somebody to look at me in the eye and honestly say yes, right?
I
That's
am with you.
that
Yeah.
is that's the ultimate bar for me.
When I came out of school, there was a guy in our area who was well known for doing very expensive dentures. And like everybody who came to him, I mean, when your only tool is a hammer, everything looks like a nail. Well, that is what they did. They were a denture mill and they were doing dentures for, teenagers. And look, they were probably most of the time they're doing the right thing and all that kind of thing. I'm not casting aspersions. It's not like I was in there
Right.
like looking at their work. But, it's kind of what I see happening now in a lot of cases. It's kind of like, oh, well, gosh, we could probably restore half of their teeth pretty well.
Yeah.
But, they came in thinking they wanted this. So, and then they justify it by saying, well, that's what the patient asked for. Like,
Yeah.
huh, well, you know what? Is that the best thing though? And
Right.
so, It's and look, there are also shades of gray. You get 10 dentists in a room, you're going to get like 8 different treatment plans a lot of times. So, we always have to be cautious and respectful of
Sure.
our colleagues. But you're right, when we start to see these things kind of
Yep.
happening more and more frequently
Yep.
and having these messes that need to be cleaned up from a surgical standpoint, oral systemic standpoint,
Yep.
it's going to be an interesting time ahead.
Yep. Yeah, for sure. For
So,
sure.
well, hey, Tom, how can people reach out to you? I mean, tell them what your website is. Tell
Yeah.
us about your podcast so people can listen to that. And then finally, tell us how we can sign up for the event in April.
So my email is very simple. It's tom@tomlarkin.com. And the event is
Okay.
oralsystemicmastery.com. And my consulting website is POW Hygiene. That stands for Proactive Oral Wellness, powhygiene.com. So those are the three best ways to get in touch with me, and more than happy to
Awesome.
set up a
Well,
consult.
hey, Tom, it's been a real pleasure. I mean, I've enjoyed getting to know you a little bit this year, and this conversation is just, I think it's one that needs to happen more and more frequently. And
Sure.
consider me an evangelist. Like, I want to help you
Thank
spread the word and, get more dentists kind of the knowledge and training that they need to do better work for their patients. And it's, you know what, you can look at it as this is a scary time with all the changes, or you can look at it as a super exciting time
you.
with all the positive directions that we can take dentistry in. And that's really my mission. And I'm so happy to have you on board with some other
Yeah.
just amazing human beings doing the right things. And so thanks again, man. Can't wait to hang out in person sometime soon.
Thank you very
All
much.
right. Well, I appreciate it. And everybody, this has been just another episode of the Foundation Dental Podcast. Thanks so much for listening. Be sure to follow Tom's information in the show notes and go to foundationdentalalliance.com for more information about the Foundation Dental Alliance and all the things that we're doing to try to make dentistry better than it's ever been. Have a great day. All right.